Okay, good morning. I'm going to call to order the joint CERS and KRS Retiree Health Plan Committee for February 12th, and we're going to begin with an opening video teleconference statement.
Thank you. This is a regular meeting of the joint CERS-KRS Retiree Health Plan Committee. This meeting is being broadcast via video teleconference pursuant to Kentucky Revised Statute Section 61.826 and may be viewed by the public at the Kentucky Public Pensions Authority offices located at 1260 Louisville Road in Frankfort, Kentucky. It's also being broadcast to the public via Facebook. If you are speaking and are not appearing by video, please identify yourself before talking. Please ensure that you are on camera when making or seconding a motion or casting a vote. In the event the video or audio broadcast is interrupted, we will attempt to reestablish a connection. If a connection cannot be reestablished within 30 minutes, the meeting will be adjourned and rescheduled to another date. Thank you.
Okay, roll call.
Yes, sir. Mr. Piercy?
Here.
Dr. Miller?
Here.
Dr. Carver? And Mr. McGraw?
Here.
Thank you.
Okay, we have a quorum. The next item up is public comment. Sherry?
Yes, sir. For this meeting, we actually received 317 public comments, all basically in support of or seeking support of House Bill 406, a COLA, or the 13th check. We also received one relating to healthcare, and I will read that one. This one is from Charles Shropshire, and he indicates, or he states as follows: retirees not electing to use state health plan need to be compensated in some other way. Thank you.
Okay, thank you very much. Next item up is the approval of the meeting minutes from September 2nd, and I'll seek a motion.
Motion made.
I'll second.
Okay, any discussion? Seeing none, all those in favor?
Aye.
Any opposed? And that motion is adopted. And our next item is Humana, and I have Tracy Garrison on the agenda to take care of that.
Good morning, everyone. I was talking to myself as I was going for my speaker button. So thanks everyone for having us. It's always a great opportunity for Humana to have the opportunity to come and present to all of you. Did want to make a couple of announcements. Humana offered early retirement back in November, and I, along with Larry Lowe, who I know some of you have seen on here for a while, we both accepted that early retirement offer. Larry's last day with Humana was January 31st, and mine is February 27th. But the great news is we've known for quite a while, well, since November, that this was happening. So we've been working very closely with the folks who will be taking over for us. So joining me on the call today is Gabe Hellinger. He'll be taking over as your senior account executive, and Stephanie Heller will be assuming the role of director of account management, which was Larry's role. And Stephanie was actually along for the ride way back when we first installed KPPA. So she's very familiar with the team and how things work for all of you. So before we move on to the rest of the agenda, I'd like to give both Gabe and Stephanie an opportunity to introduce themselves.
All right. Well, thank you, Tracy. My name is Gabe Hellinger. I've been with Humana for a little over 14 years now, 13 years of that in the group Medicare space. So very familiar with how group Medicare operates and the client management as well. So I've been in the account executive role for 4 years now. Also have experience with state clients as well from my past. So I look forward to working with you all and continuing this relationship going forward.
And this is Stephanie Heller, as Tracy noted. I will be replacing Larry Lowe as the Director of Account Management. I'm here in Louisville. I've been with Humana 16 plus years, and I was had the pleasure and honor to implement you all back for 2014 when we first implemented. So I took some time off from this account, but I'm excited to be back because it's local and easy to travel and come out and visit you guys. So super excited to be back and look forward to working with you all.
All right. Well, just before we get to the agenda too, I just want to say what a true privilege and an honor it has been to work with KPPA and the team at KPPA, Connie and everybody that works there has just been such a pleasure to work with and partner with. And I will miss the relationships that I have with all of them. So appreciate the opportunity. And I know you guys will do really well with Gabe and Stephanie. So with that, we can go to the agenda. So plans for today, we've got the 2025 member satisfaction score results. We'll share that with you along with the 2025 net promoter score information. And then I've also got the 2025 call center statistics to share so that you know kind of how this year compared to last year. And then we've got a few updates from Humana, including an enrollment review. We've got a formulary update from 2026, and then the CMS rate notice information. Next slide. All right, the member satisfaction, I'm going to turn things over to Gabe and let him go through those results. But just as a reminder, we do conduct a telephonic annual member satisfaction survey specific for KPPA members. So the results that Gabe is going to share with you today are those that we got from that. And that survey was conducted in September, October of 2025. And then he'll also share information about the Net Promoter Score, which is an ongoing measurement that Humana takes related to interactions that your members have with Humana. So with that, we can go to the next slide and I'll turn it over to Gabe.
All right, thank you, Tracy. So as we look at the annual member satisfaction survey, as Tracy said, this is an annual survey we do specifically for KPPA members. And as you'll see from the results and a couple highlights here, members are very happy with Humana. As these scores will reflect, we've seen upward trends year over year. As we can see, level setting, the Humana's goal is to achieve the overall satisfaction score of a 7 or higher across the key metrics relating to the member experience. So as we did this survey, more than 9 out of 10, 95% were satisfied with how Humana administered their plan in 2025. That's up by 3 points from the previous year. And nearly as many, 93%, said they would be likely to recommend Humana to a friend or family member, which was also a directional increase from 91% in 2024. So we can go ahead and head to the next slide, please. All right, so looking at the percentages here and trend in comparison for those results of a score of 7 to 10, 7 or higher, what we like to see. Overall satisfaction trending upwards from 92% to 95% year over year. A 5% increase from looking at a 5-year trend. Likelihood to recommend is also up. That is up over 7 points the past 5 years, from an 86% all the way to a 93% for the 2025 plan year. So as we can see through all of our interactions with Humana, members are satisfied with how they're being treated, that their issues are being resolved in a timely manner, and they can utilize the services as they expect. All right, satisfaction with claims management. The processing, 92% in 2021, up to 95% for 24 and 25 for the claims processing experience. Accuracy from a 5-year trend, 92% to a 97% now for accuracy the last 2 years, and timeliness up from an 89 to a 96%. A 2% trend difference in the last year over year for the claims processing timeliness as well. Okay. We also look at the customer care experiences. So satisfaction with the hold times menu prompts declined directionally, but still remained high for most members. That is a good thing to see, that those pain points that can frustrate members the whole times going through multiple menu prompts to get to where they need to be still remains a little high, but it is going in the right direction. Also, the amount of time required for issue resolution also remained consistent from 2024, with 79% being satisfied. Members also remain highly satisfied with their customer care interactions, and all aspects of their experience remain above 90%. And 3 of the 5 metrics improved in 2025, and 100%, which is something we rarely see in any of these types of surveys, agreed that the rep was caring. So all of our representatives that we have assigned to KPPA are engaged, know the details of the plan, know what the members expect from the plan, and that shows through the survey showing that 100% agreed that the representative that they spoke to was caring. So something I like to call out and just note that everyone assigned to this account is completely engaged and laser focused on providing a good customer care experience for the members. Okay, so disposition of the issue resolution. So this has trended upward, downward, what we like to see. 83% in the 5-year trend to a 79%, and then satisfaction with the issue resolution, relatively flat, but back in the 80s. So good, strong numbers trending upwards, especially from last year, going from 74% to an 81% of satisfaction with the issue resolution. Okay, so the Net Promoter Score, as Tracy alluded to, this is an ongoing quality score that we like to see. This is a number from -100 to a +100. Scores higher than 0, typically considered to be good. Scores above 50 are considered to be excellent. So these are questions anywhere from a 0 is not at all likely or 10 extremely likely to recommend Humana to a friend or family member on these Net Promoter Scores. Okay, so as we can see, as I said, anything above 50 is considered excellent. From 2022 on through 25, KPPA scores have remained above 70%, all-time high of 74.8 for the 2025 Net Promoter Score. We can see examples from a couple years ago with Apple, Verizon in the positive category and Facebook in the negative category, just showing comparison of how our numbers are far superior to those, even though they do have some positive experiences. Ours are much higher for the membership with these scores and with our services that we offer. All right, so we'll get into the call center statistics.
All right.
Yep.
Thanks,
Yeah,
Gabe.
thank you, Tracy. Yeah, go ahead.
I will take it from here. So the 2025 call center statistics, you can see here. So this shows the number of calls that Humana has taken. And I do apologize. In the past, I think we've been able to show a year-over-year comparison. We should be able to get back to that next year. There was just some issues with the reporting this year. So I do have last year's stats handy to take a look at. But so calls offered, so that's the number of calls that Humana registered coming into our call center is 67,018. That compares to 70,984 last year. So we're seeing some reduction in that. Calls answered 66,708. And this ABA percentage is the abandonment percentage. So the number of people that hung up before they made a connection with either our IVR or with someone on the phone was less than 0.5%. So that is an outstanding number, and it is consistent year over year from what we saw from 2024. The average speed to answer, the ASA, so average speed to answer 9.29 seconds. It took us to answer the call, and that's a solid comparison to the prior year at 9.59. Average handle time. So these are the number of seconds that we spend on the phone. So once they get through, how long does it take to get to the disposition of the call? So the average handle time is 726 seconds. That compares to 659 seconds. So a little bit longer on the calls this year. I do think, as Humana continues to work on its call center model and we strive to get that first call resolution, we do see the handle times going up, which we actually think is a positive. There isn't a rush on those calls. And, our goal is that the member will get the resolution they need and not have to call back or wait for us to return a call. So good to see that number tick up a little bit. And then the 122 there is the hold time. So that's the amount of time that maybe a rep is doing research for them. So it's after we've made the connection and we're answering questions, looking into things, we might put somebody on hold. So 122 seconds is the average hold time for 2025. That compares to 84 seconds the year before. So I think things are good in that regard. I think we feel good about how our center is performing for your members. And I think it shows through also in the Net Promoter Score and the customer satisfaction survey. As far as call drivers, just at the bottom of that, real quick, you can see the majority of people that call in are calling about benefits, claims, and prescriptions. So that's pretty typical, nothing unusual there. Next slide. All right, so here you can see the year-over-year comparison of the calls that came in. I was able to get that in here because I think it's nice to see kind of what the volume is and what's happening. So volume was higher in 2024, and I was trying to figure out like what was driving that volume, particularly in that end of the year, that December timeline. And I think in 2024, we implemented the Personify Health group to administer the ASO plans. So that I think drove some increase in volume and questions from members. So I think that's what we're seeing because really other than that, you can see year over year, pretty consistent call volume. And I think it's good to see in 2025 that December call volume didn't spike. So that tells me that people were feeling good about their renewal going into 2026. All right, we can go to the next section. So Humana also provides, you probably are aware of this, but an account concierge person. There's actually a couple of people provided to KPPA. So if there's an escalated issue that comes into Connie or anybody, any of their customer service folks, their counselors, they have a direct resource at Humana to help with that. So these are the calls and the statistics specifically for that team of people. And you can see the majority of the things that they're handling are related to demographics. So those are and enrollment. So maybe somebody lost their Part B and they're trying to get back enrolled, or there's some discrepancy. Our team will make outbound calls to the members to educate them and help them to understand what's going on and make sure they have the information that they need. All right, next. Okay, we're going to transition now into the Humana updates. I'm going to talk about the enrollment review, and then I'm going to transfer over to Carrie Lovell to talk about formulary, and Stephanie will give information about the CMS notice. Next slide. So I know Connie has spoken about, or I think she did, maybe that's coming up, about the outbound engagement that we do with members at enrollment. You can see this year we hosted 3 on-site meetings at 3 different locations: Lexington, Louisville, Frankfort. Pretty consistent year-over-year participation. You know, when there's not a lot of change happening for your members, we primarily get new enrollees, and then there's the people that come every year because it's just what they do, which is great. But we really are, transitioning more towards a virtual environment, and KPPA is adjusting well to that. You can see we also hosted a virtual call. We had 72 participants on that virtual call. So I hosted that call, did a live presentation of that information. So that was well received. And then we're seeing a significant drive and increase towards the online recorded presentation. So KPPA has a recorded presentation that Humana puts together each year. And you can see up until the end of the year, we had 1,123 views of that. And that's almost double what we saw last year. So we're definitely seeing an increase, particularly probably with your younger members. We don't really know specifically who's taking advantage of that, but good to see that. The nice thing is that's available to them at their convenience. They can look at it, they can rewind it, repeat the information. So I'm excited to see that increasing trend there. And then in addition to the KPPA enrollment events, we do also include and attend KPR meetings across the state when invited. We attended at a total of 5 locations this year, including, I think it was Elizabethtown, Bowling Green, Owensboro, and Corbin for sure, I remember. And then we saw
Louisville.
you got
Don't
it, Connie.
forget Louisville.
Oh,
said, don't forget Louisville.
yes. Oh, and you know what? It probably was 6 because we also did Frankfurt. So total of 121 participants there. So that's a nice way for us to get out, and those KPR folks like to have us there. It brings in more membership for them. And it really is a nice opportunity for us to get into the more rural locations for folks who we don't offer those on-site meetings for. Next slide. All right, with that, I'm going to turn things over to Carrie Lovell, and she's going to share 2026 drug list change information.
Good morning. We typically share these changes in the fall, but since that meeting didn't occur this year for you all, we decided we would touch on it today. And we did share this information with Connie and the KTPA team back before the end of the year, just so they would be aware of what would be happening as we headed into 2026. Every year we make annual drug list changes, also known as our formulary changes. And we do that for a variety of reasons. And you'll see some of the reasons listed here. Maybe new products come to market for the very first time. So we have brand new drugs and we have to determine how to classify those on the formulary. Sometimes we have a generic that is newly available. A brand name medication might lose its patent protection, and we have a generic that hasn't existed before. Sometimes medications have changes in their dosing guidelines or how they should be prescribed. They may get new indications where they're FDA approved to treat new disease states. So that might require some changes to the formulary coverage. And then of course, price. The prices of the medications go up and down. We want to make sure that we adjust accordingly. Next slide. So here you're going to see the impact for KPPA for 2026. We like to show you things like medications that move from covered to not covered, new prior auths that are added, new step therapies that are added, and medications that move to a higher tier. Those are the first categories that you see here, and those account for about 6.52% member impact. This is a lot lower than in 2025. In 2025, that impact was around 17%. So changes were really minimal going into 2026. Everything that moved from covered to not covered was because the manufacturer discontinued the product that was being covered. So those products weren't going to be made anymore, and that's why we see the movement there. One thing to keep in mind around your negative tier change that's listed is 432 of the members listed in that category really don't experience any cost share difference because their drug moves from tier 3 to 4 and the cost share is the same. So truly we could subtract 432 from that number, but we show it to you just for transparency. And then in addition to the changes that might have, some negative impact, we also make changes with positive impact. And we've shown you that as well. We had about a 3.98% positive impact for your members. That means their drugs were moved to a lower tier on the formulary, or maybe it used to require prior auth or step therapy and now it doesn't. So we wanted to show you both, the changes that might be perceived as negative impact as well as those positive changes. And every year we do notify members of the upcoming changes. They receive notices in their SMART summary beginning in October, and they continue to get reminders about those changes in November, December, and January. And then additionally, we send a personalized letter to the members, those mailed at the very end of October, just to let them know what changes were coming up if they happen to be taking one of the medications that would be impacted by change. We'll move on to the next slide. And Connie, we just threw this in because we know that these drugs, this medication class is in the news a lot. It's actually been the majority of a lot of the questions I've gotten so far this year in 2026. So we just wanted to do a quick review to remind you how these are covered under the Part D plan. A lot of you have probably heard this GLP-1 abbreviation. And here I've shown you what that stands for. Should anybody ever ask, it's glucagon-like peptides. That's what GLP-1 stands for. These were the medications that were originally approved for the treatment of diabetes. So the drugs that you're probably familiar with for diabetes are things like Ozempic and Mounjaro. if you watch TV in the evenings like I do, even the Olympics that have been on lately, you're seeing a lot of ads for all of these different medications. And the Ozempic product is semaglutide. The Mounjaro product is tirzepatide. And those both have sort of what we would call a sister product, really. The same active ingredient, but rather than being approved for diabetes, they're approved for weight loss, cardiac prevention, and MASH for the Wegovy product. And MASH is a type of liver disease. And then Zepbound is approved for weight loss and obstructive sleep apnea. Now, where a lot of the questions come into play is how are these covered on Medicare Part D plans? And we just wanted to review some of the highlights of that. CMS does exclude these solely for weight loss, but they are included for diabetes as long as we have proof of diagnosis that the member is diabetic. So the ones that are approved for use in diabetes are covered under Part D as long as we know the member is diabetic. The ones that are used for weight loss, it gets a little tricky because CMS excludes the weight loss indication, but includes the cardiac prevention with a prior auth, the MASH with prior auth, and obstructive sleep apnea with prior auth. So Wegovy and Zepbound, you will see them on our Part D formulary, but the member has to have one of those approved indications to get those covered. It won't be covered just for weight loss alone. And then, Connie, I know there have also been questions around new products coming to market in this space.
Exactly. There's a pill,
yes,
right?
There is a pill. These Wegovy and Zepbound are injectable, except that Wegovy just launched a new oral tablet for people who have a fear of needles or just prefer tablets to needles. And that is also covered on our formulary with the same restrictions that the injectable product has. So it's also in the specialty tier, but only approved under Part D if the member has the cardiac prevention indication or the liver disease indication. So that one, you will see it on our formularies that are out there online. And it has that PA indication beside it, just so that members will know that it does require prior auth. Additionally, Zepbound just launched some new products too.
I was wondering, Carrie, just to the Medicare environment, are they not looking at GLPs for possible weight loss in the future, or is that just not going to happen? I thought I heard some news about that and that Medicare is considering.
Correct, Connie. That is called the Balance Project. And that is being considered for 1/1 of 27. Right. We don't have all of the operational details yet. So right now it's more of a concept, and they are continuing to kind of slowly roll out what that might look like or how that might be operationalized.
Yes.
So that is something that we are keeping an eye on.
Thank you.
In the future, there could be some coverage there. Currently, we're also getting some questions around programs like Trump RX, where folks can go on and the Wegovy and the Zepbound products are on there. Members can search by drug, but the very important thing that we want to make sure that our group Medicare members are aware of is that is outside of their Part D plan. Yeah. So any drugs obtained through that type of program, their out-of-pocket expenses don't count toward their maximum out-of-pocket on their Part D plan because it's separate from a Part D plan.
There's just for the board, there's just our committee, there's just a lot of interest in both groups of retirees, which, we have close to 100,000 covered lives now. So, or a little bit more. So we, with both groups, have had a lot of questions about the coverage of this. And I would say that both the DEI, the Kentucky Employees Health Plans, and Humana have been working with us to answer their questions for the retirees. And I'm surprised we don't have a bigger call surge in December because of this subject, Tracy. Thank you.
Yes, so we can go to the next slide.
All right. Thank you, Carrie. So I'll briefly cover the CMS notices, and you're probably all familiar. There's a two-step process going every year. So one, the advance notice, which has come out, and Humana is currently reviewing that carefully. And then we'll have some information to you, Connie, shortly. Just don't have it quite yet today, but it kind of talks about what CMS is proposing for 2027 from a growth rate perspective and any other things they may be wanting to include as part of the final policy for 2027. And so preliminarily, when we look at it, the growth rate is coming in at 0.09. So that is, not what we were kind of expecting, but to be understood, challenging times. So we generally see improvement between the advance notice and the final notice, or some call it the rate book. So right now is the comment period. All of the industry is providing feedback to CMS on what was presented. We'll have some bullets and highlights of what we're thinking, but we do anticipate, if things don't change materially, that we're going to see some financial headwinds going into 2027. So we're going to work very closely with you all on what that looks like, what it might mean for your plan, and anything we might want to propose for 2027 as far as benefits or anything like that. So as soon as we have something more, we'll share with you. The final notice will come out in April, and we'll quickly digest that as well, and then get back with you as we start to look at your 2027 renewal. So more to come on that, but just wanted to let you know that it is out and we're working on it. Yes, I see a question. That's John. I think you're muted.
Yeah, I want to go back to Carrie when it's appropriate and ask a question.
Well,
Yeah.
I am good. So yeah, this was our last slide. So I'll let you ask your question.
Yeah, the Trump administration put out a list of, I think, 30 drugs where there were fairly dramatic decreases in cost. Will those ultimately flow through your all system, resulting in lower premiums in the future?
Those are included on our formulary, and we did make sure, to cover all of those manufacturer negotiated price drugs on our formulary for 2026. As far as impact on prices and premiums in the future, that's something that I really can't speak to today. 2026 is the first rollout of these being included in the way that they are with the price negotiations. But that's something that I'm sure that Stephanie and Gabe and the account team will be working on as we head into 2027.
Yeah, I didn't expect a premium reduction this year, but for the future, it may have an effect.
Yeah, let me add this, and I don't know if Connie, so I know that they reduced the price of the drug, but keep in mind that I think it's going to have a nominal impact on premium because it also impacts the rebates that insurers get. So while the drug dropped down from 200 to 100, our rebate may have gone from 50 to 10. So now the net impact to the plan is 0. So it's a wash. Now, does it help the individual market? More, yes. But I just think of our group plans that have much richer benefits, we're not going to see as big of a premium impact because there's a give and take on both sides from the cost of the drug and what the manufacturer will rebate us for. And they're going to reduce those, right? Because they need to be able to adjust for cost as well. So I don't anticipate it to be a significant premium impact for our group plans.
Okay, thank you.
You're welcome.
Stephanie, we normally in the May meeting have a lot of those renewal points. Well, these points that Mr. Chilton's bringing up, and Carrie and you all. So yeah, maybe we can kind of use last year as a template, but that's kind of what they expect in that May meeting, because that's really the next time the joint retiree healthcare committee meets, and discusses, and I know the renewal's not due till later, but they sort of look at, hey, do we want to change anything? What's going on out there? What does the new bid look like for Medicare? The things you've mentioned so far. And I think just, adding all this in Mr. Chilton's questions would be a good place to flesh that out from the bid. Just a FYI. Thank you.
All right, that concludes the presentation we had prepared today. We'd be happy to take any questions about any of these topics or anything else that might be on your mind. All right, if there's no
Looks like we
question,
don't. Yeah, looks like
Yeah.
we don't have any. So is that it for Humana?
that's it.
All right. Well, Tracy, congratulations and best of luck in retirement.
Thank you.
All right. Let's move on to other business. Abby Sutherland has open enrollment statistics.
Good morning. The next few slides are going to be our annual update on how the KHP open enrollment went. The first few charts are going to do a comparison of 2026 to 2025. And the first chart shows the number of enrollments completed online and those processed by KPPA staff or counselors. There was a small increase for online enrollments and those processed by our staff. This slide is concerning the Form 656, which is the annual requirement for hazardous duty retirees to verify their health insurance dependents are eligible for contribution. The number of forms completed online and those processed by our staff are comparable for both years. So we do have our hazardous duty retirees being compliant. We communicate with our retired membership in multiple ways. The most common way is by phone calls. You can see the comparison between 2025 and 2026 for phone calls are very comparable. There's about 300 less calls in 2026 than 2025. The emails are also very comparable. We did see the visitors in office and virtual go down a little bit this year. We do outreach with the KHP benefit fairs. We attended 3 of those this year, and the largest attendance was Frankfurt, which follows along with previous years. Next slide. And then we also do 3 KHP webinars each year, and then we place a recording of the webinar on the KPPA website, and our views for that video continues to increase every year. And just like Humana, we do attend various KPR meetings, the largest attendance always being in Frankfurt. And so we had 120 at the ones that we attended. So we had some good outreach again this year. Do you have any questions?
I have one. Do we have any idea what either the raw number or the percentage of hazardous duty retirees that did not do the 6256 and were therefore charged for health insurance?
We did have about 1,000 to 1,100 that did not complete theirs prior to the end of 2025. We have received more of those in January, so they have received refunds for the month of January. And we sent out an additional 700 letters in January asking for those forms. So the number continues to go down each year. They are being more compliant. We do send out an email blast in October. It's in the open enrollment materials, and then we do the additional letters individually. So it is getting better each year, but we would love to see 100% turn those forms in every year.
Abby, don't we do the letters in December and then again in January?
In January, yes.
Yeah, and make sure they're not dupes, like we haven't received them, so we pull out, So I think we really try hard to reach out. It causes a lot of course, delays getting out supplemental checks to them because, we're talking $1,000, $2,000, some of these keep plans, and that's Mr. Piercy shaking his head. And so, yeah, and that is a huge shock when you get that, but I mean, we've got it on the front cover of the book. We send out letters.
The email blast.
Yeah. And try to catch the new retirees. It's on the front of that book too, I'm pretty sure. Or it's definitely in there.
Yeah.
So we just keep trying different ways and appreciate any input or suggestions, Mr. Piercy and
Absolutely.
team and
Yeah,
committee.
so 1,000 out of roughly how many? Do we know how many hazardous duty retirees we have?
We, of course, the hazardous duty retirees, it also depends on if they have insurance dependents.
Yeah.
So, we processed, several, a couple thousand between the online enrollment and the forms received by the end of the year. So it's probably about 4,500 that we have that has health insurance dependents that may be eligible for contribution.
Roughly a quarter don't fill out the 6256. Okay.
Right.
And you mentioned new retirees, Connie. One of those new retirees reached out to me, and I think she just totally misunderstood and was told if you don't have to do anything. And
yeah,
so, and
I've took a recommendation to put on the front of the book. One retiree pointed out to me that we had required around the Living Well Promise and we had required everywhere else except the 6256 notice. So I'm going to put that because he said that. And I said, he said, I would have read that. So I'm going to take that as another suggestion, but that's how I've worked this and gotten some, so I'm like I said, I'm looking for any other suggestion you all can come up with, but it's consistently on the cover and they miss it. But the letters, and some of these go paperless and some of them go, no, the letters go out. We mail them, so that's not paperless. The email addresses can be. So that is actually why we've kept that as we mail those letters to try to get them before January when it impacts their payroll. But trying to remind them ahead of time, it's on the cover of that book because that's what we send out. So, and then their new retiree book they get to enroll has that. What they're forgetting, a lot of them forget, Mr. Piercy, that it's just they did it last year, they think, but they really did it the year before. So I've told them all to start looking every November. Put a note. You have a job to do. It's always, so we've started just, when I'm responding to them individually or when staff's responding, we add that reminder. So I think we're catching that group of people that failed. They may go ahead and take those efforts. So I've really gone to that kind of an outreach, asking them to take this on and do this. Because the same thing with the Living Well Promise for those Kentucky employees on the KEEP plans. That's the other stickler every year with, around 1,000 or so, I guess. I think that's about what it ended up being. So yes, those are two areas that are both very challenging.
Yeah, and I don't really know. I mean, obviously, we're never going to get 100% compliance on this, but I really don't know. I think what happens is a lot of times in a passive enrollment, they just think they don't have to do anything if they don't want to make any changes, even though it's written in red and in big letters.
I know.
And I know it is. But
Exactly.
they say, well, it was a passive enrollment, so they never log on to their account, so they never do the 6256. And then when they get charged $1,000 in January, they call me wanting to know what I've personally done to them, which is always, I always get a good kick out of that.
Of course, you did it. I'm sorry, Mr. Piercy.
No. Look, you all take a lot more calls than I do, but I don't know really how to make it. I've thought about this a lot too. How can you somehow force a compliance so that this doesn't happen? And I really don't know how to do it.
Yeah.
No, but it is getting better each year. So we do see less and less that get charged in January. So whatever we've done, all the little suggestions and things we've done is working. It's just a little bit at a time.
Something like that. I think, yeah, it's just a hard outreach to get.
Right.
Consistently.
I agree. Okay. Abby, are you finished?
Yes.
Okay. Any other questions for anyone? And if not, I think my, here we go. We don't have any other business. That is the only other business. So I think we've come to the conclusion of our agenda, correct?
Yes.
Okay. No one has anything else. I'm going to adjourn the meeting for the day. Thank you as always. And we'll, John, do you have something?
No.
Gotcha. Okay. John raised his hand to say no, so we are we we are finished with the agenda. Thanks for everybody's time, and we'll see you at the next one.